Do you suffer from chronic chest pain? Well, listen in, because this commercial's for you.
Oh, are you okay? I'm not feeling so good. My chest hurts really bad.
Hello class, my name is Dr. Miller and I will be your professor on the complete history of nursing. Today's topic, Florence Nightingale, and how she influenced the beginning of nursing. Florence Nightingale was not today. Class dismissed, we'll go over this next time.
Case study yesterday.
Do any of these situations sound familiar to you? If so, you might make a great candidate for nitroglycerin.
Help! Help!
Angina is chest pain or discomfort caused when your heart muscle does not receive enough oxygen-rich blood. It may also feel like a squeezing or pressure on the chest. Angina is able to radiate to the shoulders, arms, neck, jaw, and back. In some patients, angina may even present as indigestion. Normally, this happens in women. Angina itself, however, is not a disease. Rather, it is a symptom caused by underlying cardiovascular problems. Normally, this is due to coronary heart disease. The pain happens because the coronary arteries are narrowed or blocked. This is called ischemia, and is what causes the heart muscles to not receive enough oxygen.
Ever since I was diagnosed with chronic chest pain or angina, I've had such a hard time working out, and I haven't been able to enjoy my life ever since.
I always thought it was just an excuse to get out of the workout.
Because of my chest pain, I haven't been able to make it to many of my classes this year.
Since developing chronic angina or chest pain, I haven't been able to teach a full class in over a semester.
Nitroglycerin is a vasodilator from the nitrate class. Scientists are unsure what receptors it binds to, but they do know it widens coronary arteries to allow oxygen-rich blood to the heart.
The dosage sublingually for an adult is 0.3 to 0.6 milligrams. This may be repeated every 5 minutes for 2 additional doses for an acute attack. The translingual spray is 1 to 2 sprays. This may be repeated every 5 minutes for 2 additional doses for an acute attack. Sublingual tablets should be held under the tongue until dissolved. Avoid eating, drinking, or smoking until the tablet is dissolved. The spray should be sprayed under or on the tongue.
Contraindicated in hypersensitivity, severe anemia, pericardial tamponade, constrictive pericarditis, alcohol intolerance, concurrent use of PDE5 inhibitors such as sildenafil, tadalafil, vardenafil, or riociguat. Use cautiously in head trauma or cerebral hemorrhage, glaucoma, hypertrophic cardiomyopathy, severe liver impairment, malabsorption or hypermotility, and cardioversion. May compromise maternal or fetal circulation. Use cautiously in lactation. Notify your doctor before taking this medication if any of these pertain to you.
Nitroglycerin used with sildenafil, tadalafil, or vardenafil may result in severe hypotension. Concurrent use is contraindicated. Concurrent use with riociguat may also result in severe hypotension. Additive hypotension with antihypertensives, acute ingestion of alcohol, beta blockers, calcium channel blockers, haloperidol, or phenothiazines. Agents having anticholinergic properties such as tricyclic antidepressants, antihistamines, and phenothiazines may decrease absorption of translingual or sublingual nitroglycerin. Nitroglycerin can cause dizziness, headaches, apprehension, restlessness, weakness, blurred vision, hypotension, tachycardia, syncope, abdominal pain, nausea, vomiting, contact dermatitis, flushing, tolerance, cross-tolerance, and/or alcohol intoxication.
When taking nitroglycerin, make sure that you are not using any alcohol and ask your provider before taking any over-the-counter medications. make sure that with the application of translingual or sublingual medication that you are already in a sitting position and move slowly to avoid orthostatic hypotension. Call your provider if you experience any dry mouth or blurred vision, and make sure that you keep the medication in its original glass or metal jar to avoid it losing its potency. If you feel chronic angina coming on, take this medication and wait for 5 minutes. If pain does not subside, take again and wait 5 more minutes. This can be repeated for a total of 3 administrations. At that point, if pain has not subsided, call an emergency provider and chew 4 baby aspirin while waiting until help arrives. Nitroglycerin should be evaluated to make sure it's working, and the most certain method is to make sure that there is a decrease in pain and an increase in activities of daily living.
Nice. Thanks to nitroglycerin, I've been able to get my life back, and the workout's never been better.
So how do you think that case study went yesterday?
Oh, it was pretty hard. Thanks to nitroglycerin, I've been able to make it to all my classes this semester.
Any questions? Yes.
Can we get out early today too?
Not anymore, thanks to nitroglycerin. This video was made in part thanks to the American Heart Association and their description of angina, as well as the Davis Drug Guide for Nurses 15th edition for its description of nitroglycerin and the remaining information. Thank you.